With gratitude, the CLPNA acknowledges the traditional territories where we work and learn. The CLPNA regulates the practice of practical nursing on Treaty 6, 7, 8 territories, the unceded territories, and the Métis homelands. We respect the histories, languages, and cultures of First Nations, Métis, Inuit, and all First Peoples of what is now known as Canada, whose presence continues to enrich our community and whose ancestors have taken care of the land for centuries.
Welcome to an overview of the licensed practical nurse profession, regulation, accountability, and professional expectations for all LPNs in Alberta. The aim of the Alberta healthcare system is to support those receiving care to be as healthy as possible, and that requires knowledge and accountability on the part of those providing care. This requires that LPNs understand the connection between regulation and practice to provide safe, competent, and ethical nursing care. LPN professional practice in Alberta fits within a system of regulatory responsibility. The components of this framework include legislation, regulation, the regulatory college, the employer, the LPN, and the public. Protection of the public is the foundation for the LPN regulatory framework in Alberta. All components within the framework and every action taken within each component work together to serve this purpose. Beginning with legislation, the Health Professions Act, or HPA, implemented by the Alberta government, sets the parameters for health professions governed by a regulatory college. To ensure public safety, the HPA requires that regulatory colleges follow common rules in setting registration and education requirements, practice standards, and administration of a complaints process. The LPN profession is outlined with a specific schedule within the HPA. In addition, there are other federal and provincial legislation that apply to LPN practice. For example, the Health Professions Restricted Activity Regulation outlines restricted activities that a licensed practical nurse may be authorized to perform while following any standards of practice adopted by the College of Licensed Practical Nurses of Alberta. The Licensed Practical Nurses Profession Regulation expands on the HPA and provides specific information about licensed practical nursing in Alberta. The regulation outlines requirements for registration, practice, conduct, and continuing competence. One important aspect of LPN practice is the authorization to perform specific restricted activities considered high risk to the public. Entry-level restricted activities are those LPNs can perform after completing entry-level practical nursing education. An example would be subcutaneous injection. Post-entry-level restricted activities can be performed after completing post-entry-level formal or informal training. An example would be administration of diagnostic contrast agents. Advanced authorization includes restricted activities LPNs can perform after completing education and receiving approval from the CLPNA. Examples include areas of LPN advanced practice. As mentioned earlier, the CLPNA is the regulatory college for the LPN profession in Alberta, established under the HPA. Our stakeholders include the public, registrants, and individuals or groups who have an interest in what we do and who we regulate. The CLPNA's mission is to regulate in a manner that promotes excellence so that Albertans have confidence in the care they receive from LPNs throughout their personal healthcare journey. As a regulatory college and with authority under the Health Professions Act, the CLPNA's core role is to protect the public through its regulatory functions. This is achieved through establishing, maintaining, and enforcing standards in education, registration, practice, continuing competence, and professional conduct. The CLPNA's goals are to enhance collaboration and confidence with our stakeholders, strengthen service delivery, and improve practical nurse education in response to the changes and shifts within the healthcare system. The CLPNA is governed by a council. Each council member brings a unique perspective and skills and abilities that enhance the function of the council in performing its legislated mandate. The council consists of public members appointed by government and members of the profession appointed through a competency-based process. This governance model provides regulation of the profession in a transparent and accountable manner. As part of its regulatory function, the CLPNA creates standards of practice, a code of ethics, policies, and guidelines to inform LPNs of their professional accountability and responsibility. For example, the standards of practice on restricted activities, advanced practice, and supervision explain the practice and education requirements of LPNs performing restricted activities. LPNs can find supporting documents to guide their practice on the CLPNA website. Employers play an important role in building and maintaining quality workplaces that support public safety and ethical nursing care. Employers accomplish this through internal policies, procedures, and job descriptions that utilize healthcare providers within their scope of practice. LPNs practice independently or as part of a team, working within their scope of practice and job description to provide quality, person-centered care. LPN professional practice is at the center of the CLPNA's regulatory responsibilities framework. LPN professional practice is defined by legislation and regulation and achieved through the regulatory functions of registration, conduct, and competence. Being a regulated member of a health profession comes with professional responsibilities to the public, the employer, colleagues, the CLPNA, and oneself. Now, let's further explore the regulatory functions beginning with registration. To practice as an LPN in Alberta, individuals must have a valid practice permit from the CLPNA. To be eligible for registration, applicants must successfully complete a diploma in practical nursing or be registered in another Canadian jurisdiction as an LPN or have equivalent knowledge and experience. Annually, regulated members must complete a renewal application and participate in the continuing competence program to practice in the upcoming registration year. LPNs are responsible and accountable for their own practice and serve individuals, families, and groups. LPNs are expected to practice within their level of individual competence and further develop their knowledge, skill, and ability through additional education, certification, and experience. As mentioned previously, LPNs are required by legislation to demonstrate commitment to continuing competence. The Continuing Competence Program requires LPNs to determine learning for the current and upcoming years based on standards of practice. To support their continuing competence, registrants can access a range of resources through the CLPNA website, including learning modules, webinars, and practice support. LPN's legal and professional expectations are defined in the standards of practice and code of ethics of the profession. When an LPN's practice falls below professional standards, it may be considered unprofessional conduct. Unprofessional conduct is defined in the HPA and includes displaying a lack of knowledge, skill, or judgment when providing professional services and a breach of the HPA, code of ethics, or standards of practice, or other relevant legislation. Under the authority of the HPA, the CLPNA is responsible for protecting the public from unethical, unskilled, and unsafe nursing practice of LPNs. As such, there is a formal process to manage complaints of unprofessional conduct against LPNs. Protection of the public is at the core of the CLPNA regulatory responsibility framework. As discussed, registration, competence, and conduct functions support the CLPNA's mission to regulate in a manner that promotes excellence, so that Albertans have confidence in the care they receive from LPNs throughout their personal healthcare journey. This presentation provides information on the CLPNA's role in regulating the LPN profession and the importance of understanding the connection between regulatory responsibility and nursing practice. Professionalism requires that LPNs demonstrate professional standards when providing nursing care and collaborate with patients, colleagues, and other members of the healthcare team. The many components of LPN regulation defined within the CLPNA regulatory responsibility framework underpin the commitment and integrity required to ensure public safety.
Thank you for the interest you have taken in this important topic. Licensed practical nurses are regulated professionals who are committed to providing safe, effective, compassionate, and ethical care to members of the public. To do this, LPNs are required to consistently maintain and enhance their competence in nursing practice and be aware of strengths and areas in need of improvement. Please use the Ask CLPNA link on the CLPNA website to submit any questions you may have with regards to this video presentation.